Care Management Onboarding Visit Template Review. Welcome back to our Care Management Documentation Training Series. In previous sessions, we reviewed the BIMS assessment in detail and discussed the clinical objectives of care management onboarding visits. In today's session, we will walk through the complete structure and workflow of the standardized encounter note used for care management services. This documentation framework is designed to support accurate clinical assessment, ensure regulatory compliance, and capture all elements required for appropriate billing and care coordination. By the end of this module, you will understand how the visit progresses from start to finish, how to perform and document a comprehensive clinical assessment, and how to accurately complete each section of the encounter note, including the required consent process. We'll begin by opening the calendar to review today's schedule. The Care Management Onboarding visit will appear directly on your daily view. As a brief reminder, this is the dedicated visit during which patients are formally enrolled in care management services. The encounter encompasses a comprehensive clinical assessment of the patient's chronic conditions, an introduction to the programs for which they qualify, and clear documentation of informed consent, typically completed with a TMA present on site. To begin, we will go ahead and click on the patient profile to open the full documentation template. We are now inside the encounter note. We will walk through every single field so you understand its purpose, what is pre-populated by our scribes or the EHR system, and exactly where you, as the provider, need to focus your attention and make edits. Starting at the top, personal notes. This section is for internal team use only. It never goes to the facility. You can note important details here, such as the patient being nonverbal, to help the care team later. Next, the type of visit section. This is usually pre-populated correctly, but always confirm it is set to Initial Practice Onboarding. The method is telehealth, and visit conducted via televideo is checked. If you are doing an in-person visit, you will update these fields. The Chief Complaint section is often partially pre-populated by scribes. This is one area that needs your attention. Always review it and make sure it accurately reflects the patient's chronic conditions. A strong example is patient seen for evaluation and management of XYZ conditions. Add any relevant complaints the patient or caregiver mentions during the visit so they can be included in your plan. The HPI section is pre-filled by our scribes for efficiency, but this is a section that requires your careful review and personalization. You must add patient-specific details about medication adherence, recent exacerbations, associated symptoms, stability of the chronic conditions, and any history provided by the patient or caregiver. Keep it specific, never leave it generic. It's important that the chief complaint and HPI reflect the medical necessity of the visit. Next is the BIMS score section. We covered administration and scoring in detail in our last video, so refer back if you need a refresher. Right after that is the PHQ-9 section. Perform the PHQ-9 when depression-like symptoms are suspected, such as low mood, loss of interest, sleep appetite change, fatigue, poor concentration, or concern from family, staff. Scores auto-populate at the bottom once completed. Some facilities require both BIMS and PHQ-9 to be done live and in person. The scheduling team will notify you in advance. Moving down to past history, social history, medication history, allergies, immunizations, and vital signs. All of these sections are pre-populated either by scribes or pulled directly from the facility EHR. Your job is to review them carefully for accuracy and context. Because this visit is virtual, the review of systems ROS is especially important and requires your active attention. Review at least 3 systems that are relevant to the patient's chronic conditions. For example, respiratory for COPD, or cardiovascular for heart failure. Document reviewed, no concerns reported, or note any findings. The physical exam section is usually marked not applicable for virtual visits. If you are on site, you will complete and document the full exam here. Lab diagnostics and consults are pre-populated. Just give them a quick review to ensure completeness. Now we reach the assessment section. This is where you want to pay the closest attention. The ICD codes are pre-populated and list the patient's qualified chronic conditions. Below that is the patient clinically qualifies for area. This automatically shows the care management programs the patient qualifies for based on diagnosis, along with consent dates. The consent section is next. Mark yes if the patient consents, or no and select the reason if they decline. For example, NOK or low BIMS score. Contact section is for next of kin or guardian information. Our dedicated consent team will handle all follow-up outreach, so you do not need to complete this. The plan section is critical and requires your focused attention and edits. Eligibility statements and diagnosis-specific plans are pre-populated, but you must review every line. Make sure the sentence noting condition stabilization is updated and accurate, and that there are no blank medication references. Edit as needed to reflect the patient's current status. Finally, the communications section is where you can document any notes to family, the primary care provider, or nursing staff. The other info section at the bottom is pre-filled with the correct CPT codes and G code. That concludes our comprehensive review of the standardized encounter note for care management services. You now know exactly which sections are pre-populated for you and which ones require your clinical judgment and edits. In the next video, we will go even deeper into the sections pre-filled by scribes and exactly what you need to verify before signing the note. Excellent work today. This accurate documentation is how we deliver truly coordinated, high-quality care for our patients.